Manitoba's premier has a deal with the Calgary-based company to buy the province's own supply of vaccines. And your health minister has mentioned to us that he's meeting with that company too and is interested in what Manitoba is doing. And I just wondered, from your perspective, are you willing to follow Manitoba's lead in buying BC's own supply of vaccines, or is that on or off the table as far as you're concerned?
Well, certainly everything's on the table, Rob. Adrian Dix, the Minister of Health, will be meeting with Providence to talk about what they can offer us, not in the short term, but in the long term. And this has been a topic of conversation between premiers and with the federal government for the past number of weeks. As we've run into difficulty with vaccine distribution, that's led to concern in the community, which elevates up to government and into premiers' offices across the country. And Premier Pallister has taken the first step. I expect Premier Kenney will follow suit shortly. I don't want to speak for him or any of the other premiers, but this is a topic of conversation for the longer term. There's no vaccine approved for development in Canada or distribution in Canada, so we've got a long way to go before we're in a position to take on domestic supply. But it does speak to a challenge that's not just for this federal government or even the last federal government. There's been a diminishment of our ability to provide for ourselves for decades now. And I think the pandemic has brought into graphic highlight not just our need to be self-sufficient when it comes to things like personal protective equipment, medical supplies, vaccines, but a range of other initiatives as well. Agri-tech is now a very hot button item because we want to make sure that we can produce enough food to meet our needs in the event that borders close in the future. So I think the pandemic has opened our eyes to the importance of domestic supply chains, and of course the vaccines are top of mind today. But I want to reassure people that the federal government has made commitments to 6 million vaccinations being available by the end of this quarter, which is the end of next month. And we're holding them to that. And I expect that will happen. Now, the challenge, of course, is that if we're advised that we're going to receive vaccines on a Wednesday and we start booking appointments for elderly, in this case, in their 80s, for Thursday, and the supply doesn't show up, that disrupts our vaccination plan, and we're concerned about that. Not overly concerned at this point, but if this continues for a few more weeks, then we'll be in a critical situation, and we'll have more to say at that time should that occur. Today, there is no vaccine to buy in Canada. If it becomes available, we will be at the front of the line with others trying to get as much as we can to meet the needs of British Columbians.
Hi, Premier. Going back to, I can't remember who was asking about vaccines. You know, there are so many people that are waiting for this, and we hear you talk about challenges, concerns about will the vaccines show up when promised. People are chomping at the bit to get their parents vaccinated. I certainly am. Can you talk about how you're going to angle this? You know, I'm getting a lot of emails, and I know a lot of people are, and I'm sure your staff are, about when people are going to hear about when they're going to get these appointments.
Well, first of all, I think we need to put some context in how we got here to the middle of February. 12 months ago, we implemented a pandemic response plan, and at that time, I was advised that it was unlikely that we would see vaccinations in place for 18 months. So we should celebrate the fact that vaccines have been developed at the pace that they have, but we also, of course, now have a challenge about the distribution of those vaccines. The federal government will be procuring a sufficient number of vaccinations for all Canadians. We agreed as provinces and the federal government that that was the best way forward. Having 13 different jurisdictions, when you count the territories and the federal government, all trying to outbid each other for access to supply is inefficient, it's counterproductive, and as a nation, it's appropriate that the federal government oversee the procurement of vaccines. However, if we are not able to meet the expectations of the public, that doesn't go back to Ottawa, it comes back to the provincial government. And I fully accept that responsibility. We were advised that we would have X number of vaccinations in place by the end of the first quarter of 2021. The good news is we received early supplies in December that weren't expecting. We were able to vaccinate a lot of people, a lot of residents of long-term care facilities and staff. And that was the first step. And we've seen as a result, and you listen to Dr. Henry and Minister Dix in their presentations every week, we've seen a radical decline in outbreaks in long-term care facilities. So the most vulnerable people in the province are protected. And now we need to take steps to protect those who are not in the long-term care environment, starting with the most aged and working our way down. But we can't do that without supply. And me being concerned about that and complaining about Ottawa will not vaccinate one British Columbian. Working and collaborating with Ottawa and my partners at the provincial tables will. And I'm going to do that as recently or as urgently as this afternoon when we have yet another Council of the Federation meeting, followed by a meeting with the Prime Minister and his staff. So we'll be talking about these issues in the next number of hours. And I want British Columbians to be confident that as vaccines become available, we have a plan in place. Just down the street from where we're assembling here today, the Eagle Ridge dry floor has been made available by the City of Langford to Island Health as a vaccination location here in Langford, and we are reaching out through our health authorities to communities across British Columbia to put in place the infrastructure to meet the expectations of the public, and I'm confident, should supply arrive, that we'll be able to meet those expectations.
Lisa, do you have a follow-up?
Yeah, I'm just wondering, are you concerned that the lack of information right now is increasing anxiety? I know we talked to my mom's oncologist yesterday, and he's like, yes, you should get the vaccine. I was like, do you know anything about it? He's like, the information has not been great, and I'm hearing this from other people who are asking health authorities about their parents. Like, is there just a vacuum of information right now that is increasing anxiety? And why can't people know a bit more, even if we don't know the exact date?
Well, because we don't know the exact date, and that's the challenge. I mean, I want to be as open about this as possible. We've been talking about these issues for a year. We've been talking about our vaccination plan for weeks now. We brought in Dr. Penny Ballum to oversee that on behalf of British Columbians, former Deputy Minister of Health, former Chief Administrative Officer in the City of Vancouver, and now the Chair of Coastal Health, or Vancouver Coastal Health in the Lower Mainland. So we've got good people in place. We're ready to go. We don't have vaccines. It's not about transparency, Lisa. I'm telling you what I know. When we get information, we're making it available to the public. There was a disruption in the Pfizer distribution. There is now a disruption in the Moderna distribution. We have other vaccines that are being approved as we speak by the federal government. When we have more in place, like AstraZeneca, like Johnson & Johnson's Janssen product, which is a one-shot deal, we'll be getting those into the community. I understand and appreciate anxiety and frustration, but it's not from lack of giving information. It's about a lack of information. If we had it, we would tell you.
The vaccination plan for the 80-plus group would be rolled out this week. We now understand we won't hear about it until next week. Is it in doubt that that plan will start the first week of March? So can you tell British Columbians if that process is being delayed?
Well, as I said to an earlier question, I'll be meeting with my provincial colleagues and the Prime Minister later today, getting a direct update at that level. Dr. Henry works with Dr. Tam and others who are overseeing the procurement of vaccines, so she's in a better position to answer that question. I think she'll be available tomorrow. Richard, I don't want to punt that ball down the road, but I'll have more information later this afternoon, and Dr. Henry will have that information as well. Better to ask that question tomorrow, I think.
Premier, thanks for taking my question. I'm going to shift a little bit up island to the Cowichan Tribes area, where sadly 2 individuals have passed away from COVID-19 this week. I spoke to the health authority there, the head of it, this morning, and he said that while he's mostly happy with what the province has done for them this pandemic, he said not enough is being done right now. Vaccine is moving too slow, and in the future, he expects this to get worse and says he needs more help. I want you to react to that and tell me what you can do.
Well, certainly I understand the frustration that not just the Cowichan Tribes, but people across British Columbia are feeling. We were given advice that vaccines would be on the way, and they haven't arrived. And so I can understand how despondent people are. We're all looking for some hope during these challenging times. And the prospect of rolling out vaccinations to as many British Columbians who want them, 4 or 5 million British Columbians is a daunting task, but we have been working with the Cowichan tribes. The vaccination process there is well underway. Similarly, in Nanaimo, where we had outbreaks some weeks ago, we've been able to strategically use the vaccinations that we do have to suppress outbreaks, but also to give people hope that help is on the way. With respect to the leadership of the Cowichan tribes, I have a long-standing relationship there. I used to represent the area when I was first elected. My constituency was broader then than it is today because of the growth. And so I understand, and I will certainly be reaching out to talk to the leadership. If there's any more we can do, we will. But I know Dr. Henry and public health officials are doing everything they can to meet the challenges, not just in Cowichan and on the island, but in the interior and in the north, where we've seen unacceptable increases in cases, particularly in Indigenous communities. In addition to that, of course, in our urban centres, we've seen a steady flattening of the curve in Fraser Health, but Dr. Henry advised me earlier this week that we have seen increases in Fraser Health. That's disconcerting. We thought we had that under control, so she'll have more to say on that tomorrow, and I would direct you to her with respect to any other initiatives that we will undertake in Cowichan.